Okay, here we go. Nervous system. Couple of just quick review from general anatomy and physiology. All right. The nervous system is divided into two main parts. You have the central nervous system, which contains the brain and spinal cord. And then you have the peripheral nervous system, which is made up of 31 pairs of spinal nerves. And the peripheral nervous system is then further subdivided. And it is subdivided into two parts. So here we go. So you got the peripheral nervous system. That's the 31 pairs of spinal nerves. Right? And it is divided into two sections. The somatic, and somat means body. So the somatic nervous system controls skeletal muscle. So that is under conscious control. And then you have the autonomic nervous system. We went over this several times. The autonomic nervous system is then further subdivided into the sympathetic and the parasympathetic. Now this is important. Sympathetic. You got me? All right. Now, as you learned in general, nerves, when they innervate other nerves, communicate with other nerves or other cells of the body, they don't directly touch that other nerve or cell. They form a synapse, right? Remember this. Say yes. All right. So in order for nerves to communicate with other cells, they have to release neurotransmitters. So the sympathetic nervous system, the neurotransmitter for sympathetic is norepinephrine. That's the neurotransmitter, right? And it is also referred to as a beta adrenergic agonist. An agonist, right? It eggs you on, right? It helps you. It pushes you. An antagonist blocks you. Ain't that right? And then the parasympathetic, that neurotransmitter is acetylcholine. And any nerve that releases acetylcholine is referred to as cholinergic. Cholinergic. So you're going to see these terms: adrenergic, sympathetic, cholinergic, parasympathetic. All right? Now, better write this down, better not pout. The neurotransmitter for skeletal muscle contraction is always acetylcholine. Always. All right. So let's talk about this for a little bit. First of all, if you look at the sympathetic and parasympathetic nervous system, as the name implies, right, and this is important, the sympathetic nervous system, its spinal nerves come off the middle of the spinal cord. The parasympathetic nervous system, its nerves come off the ends of the spinal column or the cranial nerves. The big nerve of the parasympathetic, cranial nerve number 10, is called the vagus nerve. Bright light city, gonna set my soul on fire. There's 1,000 pretty women waiting out there. They're all playing devil may care.
Do you sing to your girl?
No.
Okay, good.
That was a slam, wasn't it? Took me a little bit, but I got it. Are you following me so far? Okay, so watch. The word para means around. So the parasympathetic nervous system is around the sympathetic. That's pretty good, huh? Say yeah, you got that. Okay. Now, here's the important piece. The nervous system controls the minute-to-minute, second-to-second changes in homeostasis of the body. So the nervous system acts immediately. The effects of the nervous system act quickly, but they go away quickly. So the nervous system, both sympathetic and parasympathetic, sympathetic and parasympathetic, are augmented by hormones. Tell me you got that. You better get this. What's the hormone? Please get this right. Of the sympathetic nervous system. That's right. And where's epinephrine released from? Get out. Rebecca hit her. What's the inner portion of the adrenal gland? The medulla. Say yeah. Now watch. Hormones take longer to act, but they act longer. So the sympathetic nervous system will stimulate the adrenal medulla to release the hormone epinephrine into the blood. And epinephrine can bind to beta 1, beta 2, beta 3 receptors. It can also bind to alpha 1 and alpha 2 receptors. You got me? And you find beta 1 where? Primarily. Come on. Heart. Beta 2, right, in the bronchioles. And then beta 3, you find them in fat cells in the liver. Tell me you got that. All right. The other important thing to understand is this, is that you always have some parasympathetic stimulation and you always have some sympathetic stimulation. For example, when you are scared, you simply have more sympathetic stimulation, but you still have that background parasympathetic stimulation. Do you follow that? So when you're resting and digesting, you simply have more parasympathetic stimulation. Say yes. So, and they typically antagonize each other. So the sympathetic nervous system is going to cause your heart rate to go up. What's the parasympathetic nervous system, specifically the vagus nerve, going to do? Cause your heart rate to drop. Tell me you got that. All right? And that's important. So drugs take benefit of knowing that. So watch. How many people have ever had a dilated eye exam? They go to the doctor, they put some drops in your eye, right? And then they say, hey, you're going to have somebody drive you home, right? Wear some sunglasses, huh? What do they give you? Ooh. They give you a drug called atropine. Atropine, listen up, watch, is a vagolytic. It suppresses the action of the vagus nerve. So if the vagus nerve is essentially cut off, so you have cut the brake, you only have the sympathetic nervous system stimulating it. So what will happen to your pupils under sympathetic stimulation? They'll dilate. Tell me you got that. See how that works? Isn't that beautiful? You like that. What's that? When they're dying? Yeah, they give them, that's to slow their heart rate to kind of help them die. And it, why do they do that? Yeah, you're right, it does. Because atropine's a vagolytic, so it's going to cause the bronchioles to dilate. That's why. They give atropine too if you got if you drool a lot. Do you drool a lot? Okay. All right, so watch. This is really important, guys. If you look, the sympathetic nervous system, again, is in series. What that means is when the sympathetic nervous system is activated, you will get wholesale changes in your body's physiology that are singular in purpose. And the purpose of the sympathetic nervous system being activated is to prepare your body to run or fight. That's why it's referred to as the fight or flight mechanism. I prefer to run at my age because I could get hurt. So you have what's referred to right here as the sympathetic ganglion, and the sympathetic ganglion allow all of the nerves of the sympathetic nervous system that shoot off the spinal cord to come together in series. So that's what allows you to produce these massive wholesale changes. All right? So if you look, and this is kind of a rerun question from quiz number 1, describe the divisions of the autonomic nervous system and the neurotransmitters for each one. Explain in detail what happens to heart rate, blood sugar, pupil size under the effects of sympathetic stimulation. Say yes. So watch. What's going to happen to your pupils under sympathetic stimulation? They're going to dilate. So pupils will dilate. What's the purpose of the pupils dilating? Why do you want the pupils to dilate? Right. So you're more likely to be scared in a dark alley when someone's trying to kill you. Right? So the pupils will dilate. What's going to happen to your blood sugar and why? What? Right. And we also know that epinephrine binds to beta-3 receptors in the liver, and that increases glycogen breakdown, right? So when you break down glycogen, that elevates your blood sugar. Say yes. So again, we talked about this before. If you're a type 1 diabetic and you're sick, you have disease, so you're stressed. So that's going to stimulate the sympathetic nervous system and cause your blood sugar to be elevated. That's why people who are type 1 diabetics, even though they haven't eaten anything, but they're sick, they still have to take more insulin because their blood sugar's high. That information right there is worth more than the tuition you paid for this class. So at break, leave, I think 32 cents per person would be appropriate. So make sure you leave that. It don't make no, never mind. You can find 32 cents. What's going to happen to your bronchioles? What's going to happen to your bronchioles under sympathetic? They're going to dilate. That's why drugs that are used to bronchiate your dilators, bronchodilators, they mimic the sympathetic nervous system. That's why the side effects are tachycardia, anxiety, sweating. Do you see that? See? Isn't that beautiful? All right. What about GI activity? What's going to happen to your GI activity? It's going to stop. That's why people, when they're in the hospital, they get constipated because they're sick. What's going to happen to the metabolic rate? It's going to go up, right? Because the effects of epinephrine. What's going to happen to blood clotting? When are you more likely to get cut? When you're sleeping or when you're running or fighting for your life? I'm going to write that down. So under sympathetic stimulation, blood clotting increases. So the ability of your blood to clot once it's out of a vessel increases. And that makes perfect sense. Say yes. Can I show you something? Watch, watch. You ready? You ever hear of spinal shock or neurogenic shock? Never? Okay, watch. Well, they're having a good time. Watch. Yeah, I know. That's what we should go. I should teach cosmetology. All right, that looked good. That haircut, good. Now you can ambulate home. Okay, watch. Typically, the nerves of the sympathetic nervous system start at thoracic vertebrae number 1. Are you with me? Guys? That's the sympathetic nervous system. So if you damage your spinal cord above T1, can your brain communicate with your sympathetic nervous system? No. So what happens in people when they have a spinal cord injury, a high spinal cord injury, what does the sympathetic nervous system do to all of your blood vessels? Oh. What does the sympathetic nervous system do to all of your blood vessels? Well, that was your other choice. Write this down. Epinephrine is a massive arterial vasoconstrictor. The sympathetic nervous system is also a massive arterial vasoconstrictor because epinephrine is the hormone of the sympathetic nervous system. Are you following me? If you have a high, like a T1 or above spinal cord injury, can the brain communicate with the sympathetic nervous system? So what will happen to all of your blood vessels? Doesn't communicate. So what will happen to all of your blood vessels? They dilate. So in neurogenic shock, a high spinal cord injury will result in massive arterial vasodilation. Do you follow that? Because the brain can't communicate with the sympathetic nervous system. And if that happens, according to Ohm's flow law, if the arteries dilate, what happens to resistance to blood flow? It goes way down. And that means your systolic blood pressure is going to go way down. And if you don't maintain a mean arterial blood pressure of at least 60, you're in shock. What caused it? A high spinal cord injury, typically above T1. That's called neurogenic shock. So what would you use to treat someone who's in neurogenic shock? You give them epinephrine. You give them an IV drip of epinephrine. Do you see that? Do you follow that? That is neurogenic shock. Spinal shock, it happens immediately after the injury. Immediately after the injury, the spinal cord is in shock. So it won't do anything. But if you recall, where does the sympathetic nervous system come off? The middle of the spinal cord. So if you have a high spinal cord injury, the vagus nerve will still work. So what will happen to all of their blood vessels? All of their blood vessels will dilate and their heart rate will drop. That's why initially after a spinal cord injury, the person just got hit by a car and damaged their spinal cord at a high level, their blood pressure will drop and their heart rate will drop. That's why you give them epinephrine. Say yes. You see that? That's beautiful. It's amazing. Are we straight with the sympathetic and parasympathetic nervous system? Yes.
So for that, do they do like, do you put epinephrine in a tablet and continue that, or is there another?
No, what will happen over time with the spinal shock, that's only it's momentary, maybe a couple of hours. But in that time, if that person doesn't get help, they're going to end up dying. Now, what will happen is once you have the shock period over, the swelling of the spinal cord is decreased, the sympathetic nervous system will begin to react normally. Do you follow?
Yeah, but what about people who damage it above T1, sever that? Then do they keep them on the drug?
No, they just have to be very careful about sitting them up very quickly or getting them up very quickly. They can get a condition called autonomic dysreflexia, where their blood pressure goes up really high and their heart rate drops and they can stroke out. But tell me you followed that just a little bit. A little bit. Yeah? All right. That's good enough. Okay. Look. Let me go over some of the anatomical points of the nervous system. We're still on the central nervous system right now, right? Now, if you look, how many people remember the three basic layers, the three protective layers of the brain? Do you remember that? Right? Just read it. Watch. The thin, delicate layer that covers the brain and spinal cord, that's called the pia mater, so it covers it directly. And then suspended above the pia mater, using these little protein girders, is called the arachnoid mater. And the reason it's called the arachnoid mater is under a microscope, you can see these little protein girders, and they resemble a spider's web. Say yes. What's that? Yeah. Then you have the tough dural layer that lines the inside of the skull and the vertebral column. So that's the tough layer that protects the brain and spinal cord. Now, a couple of things. If you look here, and this is important, you can see the three layers. You have the pia mater here. Then, suspended above the pia, you have the arachnoid mater. And then you have the dura mater. But in the brain, this is important, the dura mater actually folds on itself and forms like a little pita pocket. And this is called the dural sinus. The dural sinus contains venous blood. And this is important when we talk about cerebral spinal fluid. So the dural layer of the brain folds on itself to form this little pocket of venous blood called the dural sinus. Are you with me so far? Now, in this orange area, this area right here, bless you, this is called the subarachnoid. Can you see that? The subarachnoid space. And in the subarachnoid space is where cerebral spinal fluid circulates. And cerebral spinal fluid circulates around the brain and spinal cord. And I mentioned this when we started talking about like quiz number 2. I explained to you that the central nervous system does not have a lymphatic system. So the environment of the central nervous system has to be tightly controlled. You don't want stuff willy-nilly going into the brain and spinal cord because it will really present problems. So, watch. In the hollow chambers of your brain, you have 4 ventricles. Ventricles are spaces that are typically occupied by fluid. You have 2 lateral ventricles, a 3rd ventricle, and then the 4th ventricle. And inside the ventricles, you have specialized cells called the choroid plexus. The choroid plexus is where cerebral spinal fluid is formed. And just so you know, cerebral spinal fluid, can you see that? Nah. Cerebral spinal fluid, CSF, come on, is basically filtered blood plasma. So, because the plasma of the blood is mostly water, cerebral spinal fluid should be clear. And basically what happens is in the choroid plexus, you have arterial blood that comes into this choroid plexus, and then that arterial blood, the plasma, is filtered. And that's what produces the cerebral spinal fluid. Oh, this is important. On average, an average adult makes about 450 to 500 milliliters of cerebral spinal fluid per day. But at any given time, there's only about 150 cc's circulating around the brain and spinal cord. So cerebral spinal fluid is produced in excess, so somehow you have to get rid of that excess cerebral spinal fluid. And I'll explain that in a minute. This is what I want to show you. This function of cerebral spinal fluid. Number 1, it cushions and protects the brain and spinal cord. It provides buoyancy. You know, you put something in the water, it's much easier to lift than in, if it's just in the air. The reason for that is the water is pushing it up. Your brain on average weighs about 2.5, 3 pounds. If it wasn't for your CSF kind of buoying up your brain, you would have 3.5 or 2.5, 3 pounds of brain you'd have to contend with. But because it's buoying it up, that brain only weighs about 400 grams, right? So about a half a pound. That's why cerebral spinal fluid is important. The other thing that it does, because it doesn't have a lymphatic system, cerebral spinal fluid removes metabolic waste from the central nervous system. And I'll explain how that works in a minute. And then number 3 is that buoyancy. that how you spell buoyancy? Is it? Yeah, it's close enough. So that reduces the weight of the brain. Now, if you look here, what's really important, the brain and spinal cord are not connected to the skull. So the brain and spinal cord are actually floating freely in the skull and the vertebral column. So if you get into a car accident and your head hits the windshield, the brain, because it's not connected to the skull, so your skull's here, hits the windshield, your brain is going to move. So it's going to work like a little Brian Braun bobblehead doll. It's going to hit the front part of the skull, and then it's going to bounce back and hit the back part. So you can get what's called contra-coup brain damage. And essentially a concussion is a bruising of the brain. Did you get that? Buoyancy, it reduces the weight of the brain. All right, so watch. Watch. When you produce cerebral spinal fluid in the lateral and third ventricles, it will circulate around the brain and spinal cord. Now, if you look here, here's the subarachnoid space where cerebral spinal fluid is circulating, but then you have these little indentations in the arachnoid mater. Those little indentations are drains. They're called arachnoid villi or arachnoid granulations. And basically what they are drains that drain excess cerebral spinal fluid. And it's venous blood. So that excess cerebral spinal fluid that's produced then goes through these arachnoid villi, little drains, and then gets dumped into the dural sinus. The dural sinus contains venous blood. And that venous blood that's in the dural sinus is then drained from the jugular vein. And then the jugular vein goes into the right side of the heart. Now, in some babies when they're born, these little drains are malformed or they're completely absent. So the choroid plexus continues to produce cerebral spinal fluid, but it's not adequately drained. And as you learned in general, the baby skull, those bones are not fixed. So there's cartilage in between it. So what will happen is the pressure of that cerebral spinal fluid will build up, and they develop a condition called hydrocephalus. And they're usually retarded because the pressure will compress the brain and cut off blood flow to the brain. Do you ever see anyone with hydrocephalus? If you find somebody and bring them in, I'll give you extra credit. Do you know anybody? Just hold a sign. Hydrocephalus, yeah, there you go. Yeah, hydrocephalus. Mm-hmm. Tell me you followed that a little bit. You got that. All right, so here we go. I'm going to explain to you now how cerebral spinal fluid circulates around the brain and spinal cord. And I want this whole thing. That's a question. Rebecca, look. Do you see it? There you go. Isn't that beautiful? All right. What's an aperture? What's an aperture? Yep. It's an opening. There you go. All right, so watch. Where do you produce cerebral spinal fluid? In the choroid plexus of the lateral and third ventricle. And again, it's filtered plasma. This is what happens. So the cerebral spinal fluid is produced in the lateral and third ventricle. It will then travel through and around, whoops, hang on. Hang on. The lateral and third ventricle. It will then travel through the fourth ventricle. You got me? And then there's a little aperture, a little opening that allows that cerebral spinal fluid to circulate around the cerebellum. Now watch. You have two potential paths for cerebral spinal fluid to travel around the spinal cord. There is a small hole in the middle of the spinal cord called the central canal. Cerebral spinal fluid will travel around there, and then it goes through this median aperture and then spreads around the outside portion of the spinal column. That cerebral spinal fluid will travel all the way down the spinal cord and to the end of it, to the end of the coccyx, and then that cerebral spinal fluid will circulate back up. Again, you're in the subarachnoid space. So here's subarachnoid space, central canal, and then it will travel around the brain, and it will then go drain into the dural sinus through that arachnoid villi. Tell me you got that. There's some people, do you want to hear a story or no? There was a guy I worked with, he had a congenitally narrow fourth ventricle. So he would produce cerebral spinal fluid, but it wouldn't adequately be able to drain around the brain, the cerebellum, and the spinal cord. So that pressure would build up in his brain. And he actually got brain damage from it. He used to work at like United Airlines, and he was like a high-level dude. And then after having this problem, he couldn't remember stuff, so he ended up losing his job. So in people where they can't adequately drain the cerebral spinal fluid, what they will do is they will take a tube, and the tube runs into the ventricles, and then it will run under the skin of the skull, and it usually has like a little pump on it, and then it runs underneath the skin and then drains into the abdominal cavity. This is what's called a ventricular shunt. And basically what it does is it drains off excess cerebral spinal fluid and then dumps it usually into the abdominal cavity or the small intestines. Now watch. If you keep this in there for a long period of time, this ventricular shunt, the immune system is going to look at it and say, what the hell is that? And it's going to put scar tissue over it. So if you have a ventricular shunt in for a long period of time and then it happens to go bad, they don't remove it. They just put another one in. And no one can tell how long these ventricular shunts will last. They can last for 10 minutes or they can last for 15 years. No one really knows. But anyways, he told me about this, and he worked at the company for about 8 years. And then I'm talking to him one day, and then all of a sudden his eyes roll in the back of his head, and he falls down, and I catch him. So I told the lady, hey, call 911. And I'm feeling around his head for the pump. And I find it, and I started pumping it, and then like the owner and all these other people are coming around, Tim, what are you doing? And I go, I'm pumping his shunt. And then he came to, and then they got him in the ambulance, and then he had to get another shunt placed. So,
just soft enough for you to pump?
Yeah, yeah. Have you ever seen it?
No.
And you know what's sad about this, man? This dude had an awesome head of hair. I mean, I was so jealous of that guy. You know, but then he had a bunch of scar tissue, and scar tissue that you won't grow the hair, so like he had these little bald patches on it. But I'm like, what a jip, you know? I'm like, dude, you should have had my hair. I mean, look. You got it? Tell me you followed that. That's the circulation of cerebral spinal fluid. Boom. So don't mess. All right, I did real good there. Didn't I? Didn't I do real good? What's the second? What do you mean second path? Oh, watch. Hang on. So you have the lateral aperture that allows cerebral spinal fluid to circulate around the cerebellum. Then you have the median aperture that allows it to flow through the cerebral, the subarachnoid space, and then it will naturally flow through the central canal. And if you look here, if you look at this little guy right here, here you have the spinal cord. Here you have the pia mater. And then if you look, you have this space here. This is the subarachnoid space. Subarachnoid space. Then you have this, which is the arachnoid mater. And then you have the tough dural layer. And right here is the central canal. So cerebral spinal fluid will travel through the central canal and the subarachnoid space. Tell me you got that. Now, if you look at this, here's the spinous process, here's the vertebral body, right? So you have nerves, groups of nerves, spinal nerves that come off the spinal cord. So this right here is a spinal nerve, right? And you have the dorsal root and you have the ventral root. The dorsal root is sensory, right? So it can sense heat, touch, pressure, right? Niceness. And then the ventral root is motor. So watch. Reflexes are just that. They're not processed by the brain. If you touch something hot, you will sense it through the dorsal root, and then it will synapse with the ventral root, and you will get a motor response by pulling your hand back. Or if you're like some of the students that I've had the pleasure of teaching in the past, they'll just keep their hand on it and then just burn it. Tell me you got, now watch. In some people where they have pain that's not responsive to pain medicine or any treatment, what they will do is they will sever the dorsal root. You got me? So what that means is that they will lose all sensation in that part of the body that innervates it. It's called a percutaneous chordotomy. They will sever that. Tell me you follow this. And just so you know, the dura mater is continuous with the spinal nerves. So the spinal nerves are covered in the dura. Tell me you got that. Guys, one more thing. When they give you a epidural, do they give it to you, the medicine, into the subarachnoid space? Huh? Where do they give it? They give it to you above the dura, the epidural space right here. So when they stick the needle in, they're going to administer the medication here, right? Sometimes, though, you don't get a very good anesthesiologist, and they poke through the dura and the arachnoid mater. Not necessarily, but it will hurt if they hit the spinal cord. You'll know it. But the problem is you got a hole there now, and that cerebral spinal fluid will start circulating or leaking out. And one of the functions is to buoy up the brain. So what will happen is the brain will start resting on the base of the skull, and you will get a nasty headache. Tell me, you got anybody here have an epidural that went bad? You had an epidural? Oh, when you had your baby?
It was like, goodness. Like, why? Why? No.
Oh, yeah.
They like really like stand in front of you.
Oh, yeah, you move.
Knees on yours, like, yeah.
What's that?
Okay.
You were talking about when they come in and you're like, they have you like this, and there's like nurses right here, and then nurses behind you, and you're like, I was so high though. It was like, tell me when you don't feel your legs. I fell asleep on them. They had gave me sleeping pills and all.
Oh, really?
And then I had a cesarean.
Oh, really?
Yeah.
That's crazy.
Huh?
That's crazy.
It's like having bees like took off the teddy bears.
So watch. What they do for people, what they do for people who've had a bad epidural is nothing. They just end up dying. You know what a blood patch is? I did? Well, I'm going to tell some of these people didn't learn that. You can just update your Facebook status. Rebecca, are you updating your Facebook status? You don't have Facebook? Huh? I didn't hear you. Why? Oh, cut it out. I love it. I go on Facebook all the time. I stalk your Facebook too. So what they do is they put in a spinal needle again. Then they draw about 20 cc's of the patient's own blood. Blood that is outside the cardiovascular system will clot. So they will inject that blood into the epidural space in the hope that when it clots, it will block off that hole. That's a blood patch. Isn't that lovely? Just so you know, they have to go around the rest of their life with that needle in their back. Yeah, they do. You just want to kind of going boing. Yeah. Watch. What they do is they ask them as they're pushing the blood in is, how's the headache? How's the headache? How's the headache? And as it improves, then that determines how much blood they're going to put into that spot. Say yeah. Yeah. Yeah, you don't want that. That's for sure. Okay, let's see. All right, watch. I'm killing this, man. Hang on. The true spinal cord. You have the cauda equina, the horse's tail, right? Cauda equina, horse's tail, right here. The true spinal cord ends at L1. But you have nerves that come off the cauda equina, and then the horse's tail kind of embeds into the coccyx. So what they usually do is they typically do a lumbar puncture between L3 and L4. That's because cerebral spinal fluid still circulates around the entire length of the spinal cord, but you do it down there because you reduce the potential damage to the spinal cord proper. That's why you do it. Tell me you got that. All right. Oh, we're doing good. Hey, where's the...
Can you still measure the, last semester you showed us where the dude connected was a long.
Yeah, they'll measure intracranial pressure using a lumbar puncture, because if you lay them flat, the pressure in the lumbar area will be equal to the pressure inside the brain. That's why if they want to measure the intracranial pressure, they'll lay them flat and try to keep them as level as possible. Yep. All right. Why don't we do this? Why don't we call it a day today? I don't feel good. I really don't. So I don't know. Something's going on. I hope I don't. Like I'm achy. I think I'm getting something because my throat's starting to hurt. If you gave me something, Toy, I'm gonna pinch your nose for real. So this is what I'll do. I'll put together a video on that motor nerve and how it stimulates a muscle to contract. Is that okay? And then on Thursday we'll dig into it. Just remind me to do the cranial nerve quiz on Thursday. Not to do it, but to announce it. Yeah. All right. What?